about our integrated bachelor's and master's programs in medicine in English. My name is Anna and I'm going to be your host. And today I have with me our 2-year speakers, Ege and Efe, who are the students of the program, the last year, soon to graduate. And they're going to talk more about the program in depth, and then they're going to talk about their experience as well. So after the presentation, you will have a chance to ask your questions, or after the info session is done, you can also come to Ege and Efe and talk with them as well. For our people who are joining us online, please do not hesitate to write your questions in comments under the video, so we are also going to answer these questions. So enjoy the info session, and I will give a floor to Ege and Efe.
Thank you so much. Hello everyone, our dear guests here, and also the friends who are watching us online. Welcome to our info session for the integrated bachelor's and master's program of medicine. So I'm Efe Ergür. I'm a fifth-year medical student in the University of Tartu. And guess what? I'm Ege. I'm also a fifth-year medical student in Tartu. And today we'll talk a bit more about our program, and then we're more than happy to answer if you have any and all questions. So yeah, the picture you see on the right lower corner, it's from the first year, so you can compare how medical studies affected us. Yeah, so it made us look younger. So well, this way. Yeah. Here are some little details about our program. So first of all, our program is an integrated program. So basically it is for 6 years. And when you complete, you are entitled with the degree, MD degree. And you have to fulfill at least 360 credits, ECTS points. And you can read more about like what does one ECT mean. But basically you have to get like 60 ECTs per year. And at the end of the 6 years, you are getting 360, and the study form is full-time, so you cannot study like part-time medicine, part-time something. You have to devote fully, and the language requirements, which you might have many questions about it, our program is in English, so all of the teaching happens in English. However, after the 3rd year, where we have more patient interaction, we have to speak Estonian to the patients. And for that, I think we'll have a slide in the future as well. But we are having our Estonian courses in the first 2 years, we have to take them. And then after the 2nd year, we can take it voluntarily if you want to continue more, build your Estonian skills more or not. And finally, you can see the tuition fee. It has been different between years. So this is the one for this year. You can refer to the University of Tartu webpage for more information. So the basic studies in medicine, meaning the first 3 years of, let's say, medical school, is carried out in a system where you have courses in biomedicum to attend. I hope you're maybe joining the biomedicum tour as well after this. And in a predetermined order. So there are some courses available for you to pick within, but there are some courses that you have to pass. So in the further years, those courses are prerequisite to take the further year courses. So initially you have a predetermined order of courses, and then you start adding courses according to what you actually like. We have some credit details, but as Efe mentioned, the compulsory subjects are the ones that we have to pass, and these are like 274 credits. And the clinical practice, which consists of the whole year in the 6th year of medical school, is a completely different structure. So it's not simply like you go to school and have a lecture or practical or see patients in the university hospital, but it's totally different. We will talk about that. As I mentioned, in the first, 2nd years, and also additionally in the 3rd year, you can get your Estonian courses. Here it is depicted as 21 credits, but it depends how much you take as well. And then there are also electives, and these electives are actually important. You have to do at least 8 credits of electives during your whole med school. But anyways, you're gonna do like 360, so 8 credits are like quite doable. And to be honest, it's not that difficult to do extra like 8 credits of course, so don't worry about that. And also our program after 6 years ends with a final examination, which is worth of 5 credits. And this final examination consists of pretty much all the subjects in the clinical years. And it is a multiple choice test, which is done in Tartu in person. And yeah, finally, we can talk about the UIS, the Student Information System. So it's the system where we keep track of all our courses in a way, not by the means of the course like structure, but more like how many credits we have, how many credits we need to take more. And it's simply a platform where we're keeping in contact with the university, like let's say, so that we receive information from the school or from dean's office, etc. via UIS, and we select our courses, we register the exams over there. But we also have in parallel a Moodle platform, so that each course uploads their own course materials. There might be some tests or like some other activities that has to be done for the course. So those two systems are quite crucial within the course of our studies here. But you'll have a lot of time to actually learn about, like, get used to the system anyway, so don't worry about that as well. So some application deadlines for medicine in English. On 4th of March, there is the BMAT test, and the registration actually is before 5th of February, and the deadline of application is 15th of April. So before that, you should complete your application. And on May, there would be an interview online, and towards the end of May, on 25th exactly, there will be the final admission results. And on 4th of September, the school year starts. So as far as I can see here, probably all of you have, if you're interested, signed up for the BMAT exam. So good luck with your exams. And at least the entrance interview is done by a cohort of professors and teachers. Yeah, by the faculty. Yeah, by the faculty. Yeah, that's the better way to say it. And yeah, good luck if you are already signed up for the BMAT. So, admission to international medicine program. This year, the admission criteria consists of the BMAT test, which we have gone through. This test, you need to get minimum 3 from sections 1 and 2, and then there is no minimum section for for section 3. Sorry, I'm a bit hesitant because when we entered, we had the SAT subject tests 5 years ago, so this has changed. And there is a motivation letter that yields 15% of your final score, and with the same way you have the entrance interview, which also consists of 15% of the final score. So basically 70% of your point comes from the BMAT test that you have either taken or you will take soon, and the rest comes half and half from the motivation letter and entrance interview. So as you can see from the percentages, the portion what motivation letter and the entrance interview gives you, it's not something to be underestimated in a way, and it's actually quite important for you to especially find your own motivation to come study in Tartu medicine for 6 years or 5 years. That will be your profession for a much longer period of your life. So it's important to actually find the inner motivations of yours and then reflect them very clearly. Yes. So every year we usually get we start with 24 students. So the competition, or for each study place, there are 9 students applying, so it's 1 to 9. And the international medicine program actually has one of the highest competition among the other programs offered to the international students in University of Tartu. Maybe before going back to the slide, I can also mention that it is a quite international program. So there are people from many different nationalities and backgrounds. There are, of course, friends from Finland, but also friends from all over Europe. Even we had friends from Australia, New Zealand. So you can imagine the whole map. We have friends from everywhere, the world. Yes. So during the first 3 years of our education, it's mostly in biomedicum in this building, which is the Faculty of Medicine, where there you will proceed with its tour. But for the friends who are joining us online, we can talk a bit about biomedicum. So there we have the student laboratories, we have a small library for medical students as well, and we have teaching happening there, as well as all the practical classes. And simply the medical faculty and medical science is happening in that building. And also partially the education continues in the Chemicum, which is the faculty of chemistry, applied biomaterials, whatever. So basically, usually we have our chemistry classes in the first year in Chemicum, but I would say like around 90% it is taking part in biomedicum. And as Efe mentioned, it is a place where mostly all of our teachers, professors are actually working in their labs, but also we are getting taught there in the classrooms. And when you look at from the windows towards looking at the hospital, you can actually see our university hospital as well. It should be in the next slide.
Yes, absolutely.
Yes. So the clinical studies
go ahead.
happen in the Tartu University Hospital, which is right in front of Biomedicum and Chemicum. It's just like a 5-minute walk. And
Tartu University Hospital is a third level intensive care center, trauma center, and it's actually responsible for majority of the southern Estonian healthcare in a way. So most complicated cases within the southern region of the Estonia come to Tartu. So you have a lot of different exposures to different kind of patients.
And as Efe mentioned, basically everything you can find in Tartu University Hospital, or Tartu Ülikooli Kliinikum, as we call it. And now recently the new buildings for Children's Hospital and then the ENT hospital is built and integrated. So maybe by the start of new academic year, you could see the new hospital buildings as well.
And there are also some other hospital buildings within the city that you might have to actually visit within your studies. But more and more, it's being centralized and being brought together to the Mario Moisa Hospital area, so that all hospitals are joining together.
And in the clinical years, of course, even though we are having our classes in the hospital, we still have like seminars where we sit in a room with a doctor, teacher, and then we discuss about that day's topic, and then patients go over their labs, charts, etc. And then also afterwards we go to the ward side, the clinic side, to interact with patients, go over their history, medications, etc. So basically clinical teaching looks like that. And then we have in 4th and 5th year, you have one subject at a time. So basically, for example, you can have the whole internal medicine in one semester, and then you change places every month or like every 2 months, depending on the subject.
So in 6th year, unlike the previous 5 years, students have to complete a clinical practice, which during that time, students are spending a whole year in different, let's say, specialties or parts of medicine in healthcare institutions in Estonia or abroad. Unlike, as I said, unlike the previous years, you don't have any teaching happening there, but you simply work as a doctor in trainee in different wards and in different, let's say, parts of the hospital, and you gain experience next to more experienced doctors than you, and then finally you come back to Tartu and do your final examination.
Yeah, but it's not just only like they give you the badge and you go walk around as a doctor, but it is, of course, there's a structure. So you have to fill like a diary, not like a diary, what is it?
Logbook.
A logbook, sorry. Yeah. A logbook, and with, for example, one case per week that you have to formally write, and then you keep your logbooks, and then it is tracked by the dean's office so that they can see if you are proceeding with your clinical practice in the way that should be done.
Yeah, and there are also some set of like competencies that you have to follow. Like in one cycle, you have to complete like 10 different, let's say, procedures or etc. So it's closely followed and monitored. The reason why we know more about that is because we are having that ahead.
So like we have 6-7 weeks left to start. So yeah, but you'll learn more about this when you come to Tartu, and then you successfully complete the preclinicals and then also the clinicals, and then after the 6th year, then and after the exam, you are officially getting your MD degree.
And teaching and education never stops in life, which that happens also in the case of our medical studies, because after obtaining your MD degree, of course, postgraduate medical training continues, either as residency, or if you want to follow the track of becoming a physician scientist, you can move on with the PhD part as well. But regarding the residency part or the postgraduate medical education part, there are more than 44 programs available in University of Tartu or Tartu University Hospital to continue. And depending on the residency, either whether it's internal medicine related or it's surgical specialty or etc., the duration of residency changes from 4 years to 5 years, maybe 6 years. It really depends.
And there's a big, like, sometimes they ask us, so how can we get into residency in Estonia? So the system is that because we're the only medical school in whole Estonia, Tartu, we don't have another examination for getting into residency programs. But usually you have your final exam score from Tartu on one side, and then also the programs, which is like told here. Different programs every year tell how many openings they have for residents. For example, let's say pulmonology has places for 3 residents for this year, and then you would apply to that place, and then there will be an interview with the applicants who are interested, and then the 3 will be decided by the results of the exam, and then also with the interview. So that's how generally it works in Estonia.
And the benefits of our program is that, first of all, you also, since you're dealing with patients on a day-to-day basis after your basic medical education cycles, let's say, you acquire some amount of, like, even like, it's wrong to say maybe some, but you actually kind of get Estonian quite easily in hospital setting, because day to day you just, when you have to speak, then you learn it. So it's one plus thing that you get another language in your pocket. And if you are a foreign resident, you can also obtain a residence permit and a working permit to continue if you want to stay here in Estonia.
Because when you get your MD degree from Estonia, basically it means that you are eligible to practice medicine in Estonia, so that you can continue to stay here and then specialize if you want, or continue as a GP, and like basically there are endless opportunities.
And one thing I can add here is that since Estonia is also in the European Union, and within the European Union, it's much easier to switch countries within EU as a doctor. Unlike in other countries, you have to sometimes complete other kinds of examinations to prove your medical education. But within different, let's say,
EU member states.
EU member states, it's much easier to switch countries within. So that could be another benefit of our program.
And also, maybe I can also add that because our program is in also English, you get to learn medicine in English, and this has helped me so much in a way that because the international language, of course for the medicine as well, is English, so it is much easier for me to now follow what's happening all around the world in a medical side. So in a way, I'm happy that I studied in English and also learned Estonian by side.
So will it be easy? No. Will it worth it? Absolutely. So if you're more interested in joining University of Tartu for medical studies, we will be more than happy to see you next year, hopefully. And if you have any questions, please write them under the comments. It's been tracked. We're following them, and we're more than happy to answer them.
Also, if you have any questions in the house, we're more than happy to answer any and all. Let's see if we have any other slides. Yes, see you at University of Tartu. Nägemist.
Thank you so much for your wonderful presentation about medicine, program in medicine. So I guess it's time to open our Q&A session. So if you have any questions, it's a very good place, an excellent chance to ask all of them, and you will get first-hand experience.
It could be related to anything, nothing just academic, but simply a question like, okay,
how is living in Tartu? How's student opportunities?
Come and go. Well, we have a lot. Do we have any questions from the?
Yeah, we have a question online about the biomedicum test. Could you please tell more about biomedicum test, and what is the minimum score of it?
Okay, so it's about the BMAT examination, I guess. Here you can, we have briefly touched about what scores to get in what points ourselves, but here you can laser it.
Yeah, so here it says that in BMAT test it consists of 3 sections, and then in the first and second section you need to get at minimum 3 points, and then in the third section there is no threshold, and this in general your whole BMAT score makes your 70%. But yeah, sorry for not being able to answer this question really directly, because when we entered medicine in Tartu, we entered with a different test. So we have never taken BMAT.
Yeah, but for like 100% correct reference, please refer to the UT website accordingly. But this is the information from that website as well. But just to double check, you can always refer there for the most updated information.
Like this is the points that you need to get, but if you have any questions about how to prepare for BMAT, then unfortunately I guess the Dr. Google knows a bit more than us in that case. But thank you for your question and sorry for not helping.
No, thank you. No worries. It's the admission requirement changed a little bit, so yeah. There is another question which is related to admission requirements. It's about the entrance interview, what to expect from it. If you maybe, I know that you probably didn't have it as well, but maybe you know some information from...
So initially, from what I could say about the interview, is that I find it actually a very important portion of the admission criteria, because sometimes you might not be able to reflect all your thoughts and the reasons why you actually want to be here or just study medicine overall is not enough to, or like maybe you're not able to present it very well on a written way. So it's actually really nice that you actually have a chance to talk with the real faculty members who will be your teachers at some point in your journey here, to express like one-to-one directly your aspirations, your thoughts and your motivation to be here. So it's actually quite important.
And I guess the interview actually came into place with our all like what is it called? Sorry. At the end of the year, we always give feedbacks to the faculty, and then this was included by, I think, all of the students' feedbacks, because it's always good to, as Efe said, have a opportunity to talk. And as far as I know, the interview does not have any like medical or scientific or maths. It's not about like knowing stuff. It is more about
your aptitude in an academical level is not questioned there.
Yeah, you just I guess you are answering or like discussing on like your motivation to be in Tartu and study medicine here, and then what does it mean to you to be like a medical student, for example. So I guess it is more like in general to like meet you, and then I guess maybe BMAT test, and then the pointings you get BMAT is maybe much more like important in like scoring higher or lower. But I guess the entrance interview is more like just to know you in general.
And in previous years, we had some slides who were which had all the like courses in first year, second year. So actually, there are a lot of like stuff to do within the study year. So it's important to be motivated and be able to express it. Yeah.
I have next question, which is very much related to it. So studying medicine might be challenging. How do you balance studies and social life? From your own experience,
let's
maybe.
go to these. Well, it's a good question. So first of all, I must say that yes, medical studies could be tough at some parts, but it is in a way like the best and the most healthy thing is to be able to balance it. So of course we are usually in the beginning of our studies super excited and like ready to devote our everything to medicine and then like just study all the time but do nothing else. But then afterwards you might, as all of us have noticed at some point, that you might start to feel you get really tired easily, and then you're not as efficient as you are previously.
And it also quite likely correlates with the setting of the medical education, not only for here but overall, because you don't right away start seeing patients and help them and do stuff with them, but you have to actually acquire quite a lot of theoretical information beforehand to actually proceed the clinics. So that's why it's important to yes, be motivated to like do everything according to yourself, like good in a way to like continue, and then have the motivation to able to actually start meeting patients and be helpful. But I understand initially it might be quite like persons might have different understandings or feelings, because they would feel like, okay, like I came here to for example have an impact on a human life, but I'm just studying human anatomy like a lot of hours a week, like what I am doing here. But actually if you have the resilience to continue, then it's important to keep that up.
Also, I would like to add that there are many opportunities for extracurricular activities. So Tartu University is not just a university. You have also other extracurricular stuff happening. So for example, Estonian students, like there's an Estonian Medical Student Association called EAUS, and also for Finnish students there is something called TASLO, where you can join there, and then these groups organize, of course, medicine related, like for example, like conferences or like talks, which you can learn interesting things about the field, but as well have many like extracurricular activities. So you could go to like trips with them, or like get dance class with them.
And
like
you are
stuff.
very lucky because next year, 2024, Tartu is the European Capital of Culture. So I already know that there are many different events happening within the city, within the town, different cultural, let's say, exhibitions and arts and theater, etc. So there are always some interesting stuff happening in Tartu all year round, not when it's just like warm and nice, but all year round.
Yeah.
So I'm sure everyone can find something that will like detach them from studies a bit and then make them, relax and be comfortable in a way. So Tartu City has a lot to offer if you are ready to acquire them.
And also a little addition, Tartu, you might it might seem that it's just a small city in the south of Estonia, but actually remember that Tartu is the second biggest city in whole Estonia, and then it is the biggest student city, in my opinion, and I think it's quite true because there are over 7 universities in Tartu in general.
And technically, if you say that there are like around 100,000 inhabitants in Tartu, and there are like almost 15,000 students, so like student to like general population ratio is like quite high. So
it's a quite young city, I
like
must say,
vibrant city,
like student city. So as long as you are motivated to keep your studies and at the same time know your escapes, then I guess it's not difficult to continue studies. I mean, there are obviously times where we studied more hard, times where we studied more less, but basically balance is the key, like everything else in life. Yeah, sorry for the long answer. Yeah,
there are much to say about this.
No worries.
Great.
I have a few more questions. One question is, do I need to prove my English language proficiency with the international test?
According to the admission criteria that I know of, no additional proof of English language proficiency like IELTS or like Cambridge test or TOEFL, whatever, they're required. But since you will be doing the BMAT exam, you are expected to have the level of English to be able to actually complete the test. So that's like one indicator. And also you're writing a motivation letter and like having an interview online interview with the faculty. So yes, you will have like a good use of English at some point.
And that's, in a way, like important. Like, of course, beg my pardon, in the previous question I just said that entrance interview is more like discussing with the professors, but it's not just a chat you would do with your friends. Like, you have to use your language and like your what you feel in order to influence your teachers. So please take that into account as well. So and see it as a like real interview, that you do it like you would apply for a job, for example.
Thank you very much. I have one question about the transfer. Can I transfer from my university to the medical faculty?
That's a great question. And to be honest, for
we have also a question specially.
oh, okay. Oh, very sorry. Oh,
Maybe it's
floor is yours.
yeah. Floor is yours.
You cannot transfer, but I know that you have to apply via regular admissions, but then you have an opportunity to a credit transfer, which can be done via like the prior learning commission or something like that. But you cannot have a direct transfer, but you have to still apply via regular admissions. That would be my answer.
Yeah, and maybe I can also add that there are some of my classmates or some colleagues of mine who have studied something else before starting med school, and then some of the courses actually match with the courses we have. So as you have stated very well, there is a possibility to apply for the recognition of prior learning. So if you provide the necessary paperwork to the dean's office, then you can be excused from those classes and just get them recognized.
And if you have already studied something before, then it means that you have less study work to do in that case. But you have to prove it, and you can learn more information from dean's office, like what officially is needed to get it recognized.
Mm-hmm. There are no more questions online. Maybe there are any questions raised during the conversation from here.
Yes.
Sorry, I will give you the microphone so online people can hear as well.
So you mentioned about the biomedical admission test, the motivational letter, and the entrance interview, but are there any sort of weightings regarding your actual high school examination results?
I guess you have to prove that you have finished like a higher education level, as far as I
high
know.
school, not higher education.
Like I mean that high school as the secondary school education, sorry. But maybe we should ask our specialist if we need to, score really good on your.
At least I remember I have proved that I graduated from high school.
Was the question about the subjects, whether you have to learn certain subject in high school or?
Yeah, like do you have to prove that you've learned certain subjects, or do you have minimum grade requirements?
Which country have you graduated from? No, we don't require certain subjects because we require the biomedical admissions test, and this proves the requirement of the subjects which are important, but we don't look at your grades, if this is what you meant. So no, we don't look at the grades.
Yeah, I guess you have to finish
Thank
high
you.
school at least. And
Yeah, important
that's
to
a must.
finish the high school.
Yeah.
Any other questions? Okay, if you don't have any more questions, then I will invite you to our biomedicum tour, which is going to happen today. We are going to gather in the lobby at 2 o'clock, so please join and you can see where our medical students are studying. And I would like to thank again the FF for a wonderful presentation, and if you have any questions you can approach them after info session. And thanks everyone who was with us online today. You can also send us your questions. Have a great day.